Hi, and welcome back to the fourth video in the 8th lecture on Covidenomics. The last one that I'm doing from quarantine because I'll definitely get out tomorrow. And this one is going to be all about masks. The issue with masks is that they are a classic example of a positive externality. In fact, it's you doing something you don't like to do to help everyone else. So a mask doesn't particularly help the wearer to be protected from COVID-19. Yes, you can get really sophisticated masks that will help protect you, but for the cloth masks or the very simple medical masks most people wear, the protection is actually to somebody else. If you're infectious, then the mask stops the droplets and the aerosol from your breath, gets trapped by the mask, and makes it much less likely that those aerosols, that spray, will reach somebody else and infect them. So here's a nice little statement about that. The idea that my mask protects you and your mask protects me. Now, why are we talking about this in a lecture about hoarding and panic buying? We'll get to that, but first let's understand the economics of wearing masks. So here's a simple game to explain mask wearing and the payoffs from wearing a mask in a pandemic. So as usual, we've got two players, player A and player B. They each have two strategies: wear a mask or don't wear a mask. As normal, player B is the row player, player A is the column player. Player A's payoffs are in the top right hand corner of each box, and player B's payoffs are in the bottom left hand corner of each box. And it's easy enough to see that the unique Nash equilibrium here is for both players not to wear a mask. Let's just work it through. If player A is not wearing a mask, player B can either choose to not wear a mask and get 30, or to wear a mask and get 0. Remember, player B doesn't get protection to themselves from wearing a mask, they're protecting player A. So all that happens is they are worse off, they have to wear that uncomfortable mask. So player B loses by wearing a mask when player A is not wearing a mask. Of course, player A gains. Player A gains when player B loses a mask because now player B can't infect player A. But given player A isn't wearing a mask, player B will choose not to wear a mask. What about if player A is wearing a mask? Well, if player A is wearing a mask and player B chooses to also wear a mask, well, they get the uncomfortableness of wearing the mask, but now they're both protected. So they're both protected from COVID-19, so they both get a payoff of 50. But notice that if player A is wearing a mask, player B would prefer to take their mask off. After all, they still get the protection. Player A is wearing the mask, but player B can take their mask off, avoid the uncomfortableness of wearing the mask, and still get the protection. So if player A is choosing don't wear a mask, player B will choose don't wear a mask. If player A is choosing wear a mask, player B will choose don't wear a mask. Or in other words, don't wear a mask is a dominant strategy for player B. No matter what the other player is doing, player B is always better off by not wearing a mask. The same holds for player A. So in fact, just like in our prisoner's dilemma, we get the equilibrium down here where both players choose to not wear a mask, even though they would both be better off by wearing a mask, but they don't wear a mask because it's a dominant strategy not to wear a mask. Clearly it's desirable if everyone wears a mask. Classic prisoner's dilemma, all better off if we wear a mask, even though the equilibrium is everyone not wearing a mask. So how can public health officials start changing the game, changing the payoffs so that people will choose to wear a mask? Well, one way is to start putting on social pressure. In other words, to try and create social pressure so that someone not wearing a mask feels guilt. They feel that they're not doing the right thing. A simple example by this meme here shows two people wearing a mask. I wear my mask to protect you. I would appreciate you returning the favour. In other words, you are doing something socially undesirable by not wearing a mask. So let's think about how that changes the game. So here's a modified game with some guilt added. So let's take the situation where player A switches from not wearing a mask to wearing a mask when player B is not wearing a mask. So we're going to be looking at the movement from here to here. Remember, before, player B got a payoff of 80 when A wore a mask and B didn't wear a mask, because player B got all the benefits, the health benefits, without any of the cost. But that payoff has now gone down to 40. Why? Well, because player B still gets the health benefits. Player A is wearing a mask, so player B gets protected even though they don't wear a mask. But now player B, they feel guilty. They're socially doing the wrong thing. People look at them, sort of funny in the street. Sort of, hey mate, why aren't you wearing a mask? So we've reduced the payoff to not wearing a mask when the other player is wearing a mask. And we've done that for both player B and for player A. What else did health officials do? A second approach is to try and reduce the costs of wearing a mask. And that's what this little meme is doing here. You wear a mask in public. What, like it's hard? It's not that hard to wear a mask. You shouldn't stress about it. Just wear a mask. Do the right thing. So it's trying to reduce the costs that someone sees when they wear a mask. And to see that, we've changed the game again. So now we've got the situation where if player A doesn't wear a mask and player B doesn't wear a mask, player A gets 30. But now if player A puts a mask on, well, they used to get a payoff of 0, but instead now player A is going to get a payoff of 40. So rather than going down, player A's payoff is going to go up when they wear a mask. Because, hey, it's not that hard to wear a mask. So you have this mix of reduce the costs, increase the social benefits of wearing a mask. And by doing that, we've changed these payoffs. So what's the equilibrium of this new game? Well, it's pretty easy to see. Imagine we start off with them not wearing a mask. Player A's not wearing a mask. If player B puts on a mask, player B's payoff goes from 30 to 40. So player B prefers wearing a mask. Similarly, if player A's wearing a mask and player B's not wearing a mask, they get 40. But if they put on a mask, they now get 50. So player B prefers to wear a mask. So we've now turned wearing a mask into the dominant strategy, and the unique Nash equilibrium now is for everybody to wear a mask. By using social pressure, we've turned the bad outcome of the original prisoner's dilemma game into an alternative situation where we now get to the good outcome. So this all seems pretty straightforward and simple, except that's not what public health officials did. In fact, what public health officials did was they stated that our original game was wrong. That in fact there weren't benefits from people wearing masks. Let me give you a couple of examples. So for example, the US Surgeon General tweeted, "Seriously people, stop buying masks. They are not effective in preventing general public from catching coronavirus. But if healthcare providers can't get them to care for sick patients, it puts them and our communities at risk." Or the World Health Organization, this is in late March. "There is no specific evidence to suggest that the wearing of masks by the mass population has any potential benefits. In fact, there's some evidence to suggest the opposite, in the misuse of wearing a mask properly or fitting it properly." So, health officials were saying that there's really not any benefit from the general populace wearing masks in a pandemic. The only problem with that is it looks like they were wrong. Experts pretty quickly responded to these statements by high-ranking public health officials to say, no, people should be wearing masks. So here's for an example from the Boston Globe. Now this is March 19th of 2020. This is by a public health official and by an epidemiologist. And they simply say the guidance against wearing masks for coronavirus is wrong. You should cover your face. And they run through the evidence. relating to the benefits of mask wearing for the population. By early April, academic articles had started coming out, putting forward the case based on empirical evidence for universal cloth mask adoption, beyond healthcare workers and to the general public. For example, this article by a mixture of economists and epidemiologists notes that they recommend the immediate universal adoption of cloth face masks. The reason? Well, universal adoption will likely slow the spread of the virus by reducing transmission from asymptomatic individuals. And here's a meta-analysis that was published in The Lancet, one of the world's leading health journals. Its message is pretty clear. Face mask use could result in large reduction in risk of infection. So if the scientific evidence was there, why did senior public health officials recommend against universal wearing of masks? Well, the reason is simple. At the start of a pandemic, people looked towards East Asian countries, which had pretty close to universal mask wearing and seemed to be very successful in reducing the spread of the virus, and people started buying masks. In fact, they started hoarding masks. And there was a real fear in a number of Western countries that as their citizens hoarded face masks, the medical professionals who needed those masks and were at much higher risk of contracting the virus, that those medical professionals would be left without masks. So what they tried to do is change the game in the opposite way. So just a reminder, here's our original face mask game. Don't wear a mask is the Nash equilibrium, the dominant strategy equilibrium here. And we saw how social pressure could move that to a wear mask equilibrium. That appears to be where we were moving, even without health officials changing social behaviour deliberately. It appears that the populace was moving towards this outcome. And because of fear of that and fear of hoarding, the public health officials moved the game so it looked like this. Their statement was that if you don't wear a mask, well, you avoid the annoyance of wearing a mask. If you do wear a mask and the other person's not wearing a mask, well, you get a loss by being uncomfortable. That's just like in our original game. But if the other player is wearing a mask and you also wear a mask, there's no benefit, there's just the loss of being uncomfortable and wearing a mask. In other words, the claim that mask wearing doesn't help was an attempt to reduce the payoffs associated with everyone wearing a mask. In other words, they were claiming the positive externality didn't exist. The problem is that the positive externality did exist. And as the evidence came out, and as production lines improved and any issue about a shortage of masks disappeared, those senior public health officials had to start stepping back, changing their mind and saying, well, actually, we do want everyone to wear a mask, but masks are beneficial. Now, some people have claimed that that was a pretty bad outcome because it undermined people's faith in those very same public health officials. But it was harder to get people to wear masks when they'd originally been told don't wear them and then told do wear them. They were originally told they're not effective, then told they were effective. Whether that's true or not, that's an empirical matter. It's beyond the scope of this course. Joshua Gans, in his book, Economics in the Age of Covid-19, suggests that regardless, it's not a great strategy. It stopped the hoarding, so in that sense it was successful. But by undermining trust in the government officials, it had a negative effect. And I think I agree with Joshua when he says that probably a better way would have been to say to people, look, mask wearing is beneficial, but what we really have to do is protect our public health workers. So don't buy masks yet. We'll tell you, we're working to get the production going. We'll tell you when it's fine to buy masks. If you've hoarded some already, please donate them to hospitals and so on, because we don't want there to be a shortage there. And then later on you can buy the masks. And I agree. I think that would probably be a better result, because what that's doing is changing the game in a different way. It's saying, yes, masks are good. Yes, at some stage in the future, there will be social pressures to wear a mask. Not quite yet. And I think that would have worked, but we don't have that experiment to see. Okay, that's it for now. Bye-bye to the hotel room in the Western Brisbane. Next time I'll be talking to you from outside quarantine. Talk to you then.